Dr. Leah, a pregnant woman writes, "My husband and I are having a baby boy and are debating whether or not to circumcise him. What are the benefits or drawbacks of circumcision?"
Well, let's start with the benefits. There are lowered rates of sexually transmitted infections, also known as STIs, which is not something most new moms are worried about. But this can be caused because the other side of the foreskin contains immune system cells which easily attach to HIV cells. The foreskin also can get some small tears during intercourse that could allow HIV to enter the bloodstream. There's also a decreased risk of urinary tract infections, which is important because UTIs can introduce bacteria into the bloodstream, which could possibly lead to kidney damage. Another great thing about circumcision is it could reduce the likelihood of HPV or human papillomavirus. It could also reduce the likelihood of herpes too. And newborn circumcision can also provide protection from penile cancer, which typically only occurs in the foreskin. Good to know, though, that risk is relatively low in developed countries like the United States. Of course, circumcision also has some negatives. Circumcision must be performed by an experienced medical doctor. It must be performed in a sterile environment. And with any surgery, there's always potential side effects and complications that can occur. Typically, those are just like extra bleeding or infection, and usually those are cleared up with antibiotics. There can also be some adhesions that can become irritated, and those can restrict the size of urinary opening, which could also lead to urinary tract problems. Infants also do experience pain, even when they have anesthesia. Many families feel like they simply don't want to put their child through this painful procedure when he could simply live a healthy life without it. Some men also claim that uncircumcised sex is better, and that would make sense since there's thousands of nerve endings in the foreskin that have to be removed. It is important to note also that some circumcisions have been botched. It is rare, but there was a relatively recent case where a man in Egypt's son got gangrene and his penis actually had to be removed. There was also a really tragic case of twin boys back in the 1960s, and the penis was not able to be reconstructed, and they replaced it with what they thought was going to be a functional vagina, constructed surgically. So he essentially went through gender reassignment surgery without his consent, and it was an unbelievably tragic case. On a lighter note, sometimes it just doesn't come out looking right. So must be cautious with all of these things. See if you have a family history of bleeding disorders. Obviously, you must talk to your pediatrician before considering getting your son circumcised. And last thing, if your baby's born prematurely, you'll need to wait until he's ready to leave the hospital before having this surgery.
Dr. Leah, a 25-year-old man writes, "My female partner just tested positive for HIV, but I tested negative. How is this possible? Should I take another test? I'm so worried."
I understand the worry, and it only takes one incidence of exposure to become infected with HIV. However, this is really rare depending on the types of sex that you engaged in. The receptive partner or the receiving partner is twice as likely to become infected with HIV than the insertive partner in vaginal sex. And the receptive partner is 13 times more likely to get HIV than the insertive partner in anal sex. That's because the virus found in the blood, semen, rectal fluids can more easily enter the receptive person's body through that thin lining of the rectum. The insertive partner, or top partner, you in this case, is less likely than the receptive partner, girlfriend in this case, to get the infection, which may be why she tested positive for the virus from a previous encounter, which may or may not have been sexual, and you have not gotten it. However, bodily fluids carrying the virus enter the insertive person's body through a variety of methods, the urethra, the opening tip of the penis, or any cuts and sores that may be on the penis. So it's incredibly important to get tested.
Dr. Leah, my husband has Parkinson's disease and gets frustrated that he can't achieve orgasm anymore. I try to reassure him, but how can we boost his confidence?
As with anything else, couples can minimize disruptions in their sex lives by knowing how to effectively deal with the problems that can arise. It's important to think about how these problems affect the afflicted person with Parkinson's and their partner. So it's important to know how to restore your sex lives. Parkinson's affects the autonomic nervous system, which controls sexual response and functioning. So it acts upon the neurons in the brain, causing those dopamine-producing nerve cells to die. And dopamine, that feel-good chemical, is the chemical that's going to transmit signals between the parts of the brain that usually coordinate smooth muscle movement. That's the involuntary muscle, so when you're breathing, heart, lungs. This is also critical to sexual function for two reasons. First, the dopamine drop may result in a decreased sex drive and sexual interest because you're losing that feel-good hormone. And second, lower levels of dopamine may cause a loss of balance, muscle rigidity, and even tremors when resting. So it's understandably that these slow muscle movements or even tremors can cause rigidity, and that's going to affect love-making abilities. There might also be physical pain that would make sex feel uncomfortable for someone with Parkinson's. Additionally, someone with Parkinson's may experience ED, since Parkinson's impacts the central nervous system. There are solutions here. Make sure you communicate. Many relationship issues stem from partners just avoiding these rough discussions, and you really need to discuss your concerns or fears. Lovers need to talk about what's going on in the process, the diagnosis, and how this is affecting each other in every aspect of their lives, especially their sex lives. Also, you can seek out a sex counselor. There are people that specialize in this particular area. But make sure you exemplify your support for him verbally, give him numerous compliments to maintain or boost one's self-esteem and desirability. Parkinson's symptoms typically less pronounced in the morning, so you might want to aim to make love a little early in the day, have some morning sex, but you really need to be willing to experiment. Couples need to adapt to their sexual habits and partners. Parkinson's are not. However, if you're really concerned, like I said, there are medications that can provide a hope. There are medications with dopamine agonists that can boost sex drive and can increase sexual functioning since they mimic the effects of the heightened dopamine-producing neurons. Viagra has also been helpful with significant improvements in overall sexual satisfaction, desire, ability to maintain erection, orgasm, all of these. As with anything else, when it comes to considering a medication, make sure to check with your doctor.